Hi guys, so today I will be discussing with your important micro images. I will take almost 100 images and we will try to see the different images that has been asked, right? Or with the topics we missed in our last video. We will try to cover the same topics with images and pipes, right? So let's discuss, right? So I will start with to find the images, guys. Okay, let's start with the last one. Correct. So this shows your very important slide showing your bile stained versus non-bile stained eggs. These are your bile stained eggs. Of this one is important. It's a barrel shaped egg. Bile sol this one. Bile stained means it will give brown color. Non-bile stained it will give you can see it will not show any color, right? It's like black like thing. And this one shows brown means it's bile stained. Bile is brown, right? Remember like this. It's trichuria. So trichuria is a barrel shaped egg. Barrel shaped has been asked so many times, like barrel shaped egg. Trichuria very important. And from here you should remember the ascaris. This one is same bile stained eggs. Just remember the names: ascaris, tinea, trichuris, clonorchis, P. westermani. This is lead. P. westermani is lead here, operculated lead. Okay. And this is your non-Balchin eggs. Non-Balchin eggs, this one remember is plano-convex eggs, has been asked so many times. Enterobius vermicularis. And this one hookworm eggs, H. nana. But this one, I am again marking for you. This one is important. Images has been asked. This is your scolex of tinea. Correct. So anyway, just remember these two slides. Correct. I am rubbing it for you. I am showing you again. So just yes, correct. So this one, please see it before you go for any exam. From here one egg will come, definitely, no doubt about that. Let's go to the next image. So this is our next image. So this shows something like this. See, as I mentioned in my previous class, that I will discuss all the important topics. See, this is your corynebacterium diphtheria that causes diphtheria, typical V-shaped or Chinese letter arrangement. See, it is gram positive rod, right? It looks something like this. This is your nocardia or asteroids, right? Gram positive filamentous rods, right? Acid fast staining is there, right? This looks something like this. Correct. Don't forget these images, very important, has been asked. So nocardia, gram positive filamentous branching rods, acid fast. Okay. What is this? This one, guys, your actinomyces that I told no. This is also modified acid fast positive, and a filamentous branching. But the most important is you have to look to the history, any dental procedure done or dental extraction done. Correct. So this takes you towards actinomyces. Correct. So I'll be discussing very rapidly, so you have to watch my previous session to understand, because I've discussed everything there. Same, this is your nocardia species. Correct. This type of this image is will not asked. What is asked, you may see some acid fast like thing, some blue background, right? Otherwise you also can determine, see, you can also distinguish these are branching pattern, right? And particular history is very important. Only identify will not come, right? This was asked previously, not asked nowadays. A case, you will find a case scenario which should make you easy to diagnose, right? Okay, what is this? Let's see. Okay, so this is your Donovan bodies of Klebsiella granulomatis, right? This one, Donovan bodies of Klebsiella granulomatis. We will discuss it in brief in Dharma section, right? This is most of a Dharma image. Okay, because this I have not discussed in your micro session, I will take it in Dharma, don't worry. Okay, what is this? This is okay. This is Haemophilus ducreyi, again Dharma, I will discuss there. So school of fish appearance, this is mostly this one. School of fish appearance is this one, like it goes something like this. Let me show you. This is your school of fish appearance, right? This See, for Haemophilus ducreyi, correct. And Neisseria gonorrhoeae, as I discussed, it is intracellular gram-negative diplococci, right? Intracellular gram-negative diplococci, correct? Like this you will see, correct? Gram-negative means it will give red color. Gram-positive means violet color, correct? Anyway, I take you to the next image. Okay, so this is your Leptospira case we have discussed in our previous session. So this is your dark field microscope. Dark field microscope, because it is slender organism, we need dark field microscope. We discussed that in our previous session. And it looks something like this. It is spiral shaped. See, spiral shaped, correct. Rodents are the organism or source. Very good. Chalo. Now this one is your Treponema. Usually not asked, just for completion's sake. Treponema and Borrelia burgdorferi, same spiral organisms, correct. Just remember, these are spiral organisms. I never saw these questions, so these are not asked. Means particular this Borrelia and this one, the image sessions, image questions are not asked for Borrelia like this, right? Just remember for completion purpose. Okay, what is this? Yeah, so all right, so see, this is your enterococci. Enterococci is gram positive cocci in chains, short chains, usually causes UTI. You will find a history of UTI in females. Pneumococci in pairs, you know, this in found in pairs and gram positive. ठीक है ना? This one enterococci gram positive in chains and pneumococci is gram positive in pairs. This we have discussed, right? Okay, so next is this one. Okay, let's take this one. See, so I took this one. See, Giardia lamblia. So this we have discussed cyst and trophozoite. From cyst is quadrinucleate, 4 nucleus, right? Trophozoite, see this pattern. Trichomonas vaginalis, strawberry vagina will be there. It is a PR-shaped organism. Okay, and is an STD. Trophozoite is the only form, and it shows motility. What motility? Twitching or jerking motility. Good. Entamoeba histolytica. See. So entamoeba histolytica same, quadrinucleate cyst is the infective form. Okay, na? Correct. So this we have discussed in our last session, right? Okay, so next this one, let's see what is this. I should take a different page. This one, right? So here I tried to show you the calcofluor white stain, you know, the stain which we use for fungi, calcofluor white stain. Okay, next is Candida albicans. See, Candida albicans shows, this one has been asked, Reynolds tube or Reynolds broad or jam tube phenomena, right? So just remember. And this Candida cruzi. So Candida cruzi, just for, you know, this one for completion's sake, just remember this one, Candida albicans shows jam tube or Reynolds broad phenomena, correct? They're just highlighter points which you should keep in mind before just you know, entering the exam, right? Okay, so this one. Okay, so this is your, yeah, so this is your Cryptococcus neoformans, right? Cryptococcus neoformans, actually it is from bird droppings or bird feces, right? So it gives brown mucoid colonies, correct? And this is your mucor. I have showed you, know, this aseptate hyphae, you know, there are, you know, aseptate branching hyphae, but it is irregular, correct? So this we discussed. This is an is important, particularly in this COVID setup is very important, because post treatment patients of COVID develop mucor. Those who have diabetes or those who have neutropenia, immunosuppressions, they all develop, means chances are there to develop mucor, and treatment is, yes, good, IV, this one, liposomal amphotericin B, right? Okay, chalo. This one is your aspergillus. Aspergillus is your B forms, this one. Aspergillus we will discuss in brief in your this one, medicine, right? Okay, so okay, next is, I think this one very difficult to see. Okay, so next is this one. Yeah, so there I tried to show you different, this one, epidermophyton, trichophyton, microsporum. Don't worry, has not been asked, just to show you. These are Melasthesia globosa. Now this one has been asked, right? Tinea versicolor. See, hypopigmented rashes. Actually this is a derma topic anyway. So this one, on examination it will show spaghetti and meatball pattern. This is also important, right? Honey colored crust may be there, correct? So okay, this one, yeah, this is also important, also a derma topic. Sporothrix schenki. So actually a case will be given like, there is a rose thorn peak in a gardener, and after a few days this was seen. This is a lymphatic spread actually, okay? Lymphatic spread. So this organism is Sporothrix schenki, also known as rose gardener's disease, due to thorn peak from rose, okay? So the case scenario will be like this, and you will be asked to identify the organism. This is only, just simple. Do remember lymphatic spread. What is this? Okay, so this is your sclerotic body or medullary body in chromoblastomycosis, correct? Chromoblastomycosis, also known as copper penny bodies. This we discussed, Rhinosporidium severi in the coastal regions of India, in the southern part, protista species. We have to excise it, and followed by we'll keep depsone, right? So this we all discussed in our previous slides. This one, okay, this one, okay. So this is your coccidiomycosis ferrules, right? And this is your histoplasmosis or Darling's disease, right? So actually, why Darling's disease? Because it is found in Ohio, part of America, right? Mainly the source is bat feces or bat waste, right? This also we have discussed, right? Just to show you, it's something like this, right? In microscopy, correct? Okay, this one. Okay, this it's Streptococcus long chains, right? This yes. Regarding Streptococcus, do you remember the oxidase and catalase? Yes, correct. Okay. Next, what? Yeah, this one. So actually this is your swarming motility. 1 minute. Let me change. Yes, this is your swarming motility, right? Swarming motility. Now one question has been asked, like, what all organisms show swarming motility? Mainly on blood agar. See, there are few organisms based on gram. Some is gram negative, some is gram positive, right? So we know that Proteus causes swarming motility, but it is gram negative. There are other organisms also, like Proteus mirabilis, Vibrio alginolyticus, Vibrio parahemolyticus, all these shows swarming motility. In case of gram positive, Clostridium tetani shows swarming motility. This is your swarming motility, correct? Remember the image, maybe asked. Chalo. Okay, this one is your so this one is your Cryptococcus neoformans, right? This one is your Cryptococcus neoformans. It mainly the source of infection is bird droppings, and there will be clinical history of pneumonia like thing, and also there will be history of bird droppings, contact with bird droppings. And this is your Cryptococcus neoformans. And what is the ink? Do remember, it is India ink. On India ink, very important, right? Cryptococcus neoformans, right? Chalo, let's go to the next image where it is. Yes, we are there. Chalo. Okay, this one is about hypersensitivity, so we will discuss in brief in your pathology. Just remember, type 1 is with allergy, and this one allergy, atopy like things. So obviously there will be IgE mediated. Type 2 is antibody mediated, mainly by complement activation. Type 3 is immune complex mediated. Okay, and type 4 is delayed. Delayed means mainly CD4 or T cell mediated, right? Details we will discuss in patho, don't worry. This is the topic of patho, right? Okay, so next we will take this one. What is this? Okay, so this is your erythema infectiosum or a slapstick appearance. Now slapstick appearance is mainly caused by organism is important. Remember the organism parvovirus, also known as fifth disease, has been asked. Parvovirus, right? Okay, now this one. Okay, this is your, as you can see, this is your Molluscum contagiosum. These are umbilicated pearly white nodules. Molluscum contagiosum. This actually microscopic image is important, and I will show you at Dharma, because microscopic image has come not twice. Okay, now this one is your human papilloma virus showing coilocytes. See, coilocytes, how will you identify? See, first of all, this is your vaginal epithelial cell, correct? Now HPV will show actually the organisms will be like this, and there will be perinuclear halo, correct? The nucleus will be pushed to a side, what we say as pycnotic. See this nucleus, see this nucleus pushed to a side, what we say as pycnotic nuclei, correct? Nucleus pushed to a side, and there is a perinuclear halo, correct? And there will be sometimes organisms will be visible like red type. I will show you different picture, right? Chalo. Okay, so this one what I told you in my last session about, if a transplant patient, say a transplant patient is having your suffering from pneumonia, what is the organism? It is CMV looks like this one, okay? Auli, but there are many auli. We will discuss that in patho. One is CMV, and then Hodgkin's lymphoma, but we will take it in patho. That's a better, but just remember auli inclusion CMV, it looks like this, and in seen in transplant recipients, right, with features of pneumonia. Remember, these points has been asked, very important. Just remember the scenarios, right? Okay, next I think this one. Okay, so this is your oral hairy leukoplakia, right? So this is your oral hairy leukoplakia, you can see, correct? Mainly by Epstein Barr virus. Occurs in whom? Those who takes betel nuts and all. Sometimes there may be trismus, correct? So there is like one difference between this one versus Candida. See, Candida, the thing is that you can this one you cannot rub off, but this can be rubbed off. Okay, never asked, just for completion purpose, right? Okay. What is this? Okay, this is your Cowdrey type inclusions in herpes virus. See, herpes virus, important is there are two findings. One is there is can I show you? Very difficult to show you here. I will bring a better image. One is ground glass hepatocytes, somewhat like this, ekdam clear hepatocyte, what we say as ground glass hepatocyte. And number two is this one, Cowdrey type inclusions, what they showed you there. I will bring a good image. So this is your Cowdrey type inclusion, another is ground glass hepatocytes. Both are important, both has been asked. Okay. Okay. Okay, so what is this? Correct. So this one is your Entamoeba histolytica, right? Entamoeba histolytica we discussed in our previous session. So just look at the image, correct? It's just you have to bring the theory and collaborate with it with the images. Then your the perception about the subject will be clear. You can answer for anywhere they ask, right? No issue. Correct. Now this one is your Naegleria fowleri on immunofluorescence staining, right? Looks somewhat like this, not that important, just for you to see. This is your Cryptosporidium, this is your Cyclospora, this is your Isopspora. Don't worry, if at all they ask, there will be a history, right? Then there is a watery non-bloody diarrhea in an AIDS patient, right, or in HIV individual, and this type, and what is the organism. The important thing which you should remember is that Cryptosporidium is auto-infectious and sporulated oocyst. Sporulated, and the Cyclospora is unsporulated, right? And if it at all sporulation occurs in Cyclospora, it occurs at environment, and in sporulation in Cryptosporidium occurs at humans. Therefore, there is auto-infection plus human-to-human transmission. These all points you must remember from this image. These are asked, correct? So what are asked you should remember. Images from these rarely asked, just to show you. Okay, what is this? Yeah, this is important and this has been asked. So let me discuss this. See, so these are Plasmodium falciparum. See, whenever in a cell you will see more than, how to show you, yes, more than 2 dots. It is 2 or more than 2, it will mostly 2, it is Plasmodium falciparum. Else you can see a banana shaped gametocyte. Anything Plasmodium falciparum, anything of the two, right? And okay, this is same Plasmodium falciparum, this is also Plasmodium falciparum. Where is Plasmodium vivax? I will show you. Like if a cell is there with 1 dot, this is Schuffner's dot. Schuffner's dot is Plasmodium vivax. Just remember this, 2 dots or more, or a banana shaped gametocyte, Plasmodium vivax. 1 dot Plasmodium, 2 dots or banana shaped gametocyte, Plasmodium falciparum. 1 dot Schuffner's dot, Plasmodium vivax. Remember it, very important. Okay, this one, yes, here it is. This one is showing different forms. Okay, no vivax here. Anyway, yeah, this is also important, guys, has been asked. See, you are seeing something like this. This is Maltese cross appearance in Babesia. Maltese cross appearance in Babesia has been asked once. I think I lost it. Where was the image? One second, guys. Okay, this we already did, right? Okay, this one. This they are showing the LD body of Leishmania, LD body, right? Leishmania donovani. Actually, it is transmitted by sandfly. We will discuss it in Dharma, right? And in tissue, you will find the amastigote form. Okay, just remember it. Amastigote in tissue, right? And trypomastigote of Trypanosoma cruzi. Okay, trypanosoma means this one is sleeping sickness, right? Sleeping sickness in Africans, right? So anything, anything like this pattern, if you find, it is trypanosoma. So, and mostly in tissues you will find the trypomastigote form. Okay, just remember these points. I never saw that in any exams, but still you have to remember, right? By chance it comes. Okay, so okay, this we did, right? Okay, this one, yes, that's why I wanted to show you. See, this is your trypanosoma, yes, trypanosoma cruzi. This one is your triatom bug. Okay, this is your CC fly sleeping sickness, right? This is your Trichomonas vaginis. Yes, this one is important. A second. So this one is your Trichomonas vaginalis, right? This is your vaginal epithelial cell, correct? And Trichomonas vaginalis is a pear-shaped organism. You can see it. This one, correct? This one. This we have discussed, no? And this one shows strawberry vagina, and this is an STD, correct? And Trophozoite is the only form. It is pear-shaped, as you can see here. This one, correct? Okay, let's take my new page. Okay, so this one is your Toxoplasma Gondii in tissue cyst. Actually, Toxoplasma, this thing is not asked. What is asked is they give a skull X-ray and they give you something like this, a defect type of thing, and the history. That one is a diagnosis of Toxoplasma Gondii. This slide will not be asked, right? Okay, this is your Cyclops. Just see the image once. Cyclops. This is your flea. Flea is almost flat. Flea means flat. So just remember like this, flat organism, right? Okay. So now we'll go to this one. Yes, this I already discussed, right? Sandfly you can easily identify. It will have hairs in his body and like a fly. Now tick versus mite. So there's hard tick, soft tick, and mite. See, hard tick is hard tick. This is okay. See, hard tick will have head, soft tick no head. And what is a mite? Mite will have thick anterior legs, and thin posterior legs. See, thick anterior, thin posterior. This one hard tick, correct? Soft tick no head, hard tick head. H for hard tick, H for head. Just remember like this. Somehow you have to remember, no? What can be done? Just remember. Okay, so organisms I have taken. Let's go to next. Okay, this one, operculated egg of dilatum. Okay, X we have discussed, right? This is not a beautiful image. So one image I discussed at the very starting, no? That one is the important one. You can find all the eggs there, because images should be ekdam perfect one that has that has came earlier, or ekdam elaborative type, right? Okay, this one is a Equinox hybrid cyst. Okay, see once. History is important, right? And diagnosis. Every image is not important, just to show you what is important. I will say, by the side. So this is a egg of H. nana and egg of tinea. Tinea egg are bile stained. This is non bile stained. These are not good pictures. I have discussed it earlier. Okay. Okay, gonococcus versus meningococcus. This we have discussed, right? No cardiopathy we have discussed. Okay, so all we have discussed, right? Maximum things we have discussed. So I'm just checking if anything is left, right? Yes, this one is important. See, this has been asked, like Uchuria pancrofti. This is the what is asked is that this is a sheathed microphylla. Don't remember, you can see the sheath. That's what I want to show you. This is a sheathed microphylla, right? And the other Bancrofti, like loa, like this, all loa, this falls in non-sheathed, but sheathed is Uchuria bancrofti has been asked. Don't forget sheathed. And of course, you will take the blood sample from the earlobe, right, by 2 p.m. at the night. Treatment DEC, right? Nice. Okay, P Westermani has operculated eggs, Okay, this all we discussed, right? So I think I took all the images, all the relevant images, right? Everything though is not necessary. Okay, so this one has been asked once, right? This is about your Japanese encephalitis virus, how it transmits, right? So remember, one is ardid birds, man and pig, right? And a mosquito. So first of all, Culex mosquito. Pigs are the amplifying host, and mosquito pass it into ardid birds. These three are the hosts. Man is an accidental host. This is about Japanese encephalitis virus. If this chart is given, do remember it is about Japanese encephalitis virus. Again, a chart may be given with Aedes mosquito, and then placental transfer of some organism, placental transfer causing microcephaly. If such type is there, Aedes mosquito is there, it is about, yes, tell me, microcephaly, Aedes, right? What I am talking about? Yes, Aedes, a microcephaly, transplacental route. Yes, it is the hot topic. Zika virus, correct? Has been asked twice or thrice. Don't miss it. Zika virus. Aedes is the important. Microcephaly, placental transfer, right? These are important, right? Okay. Okay, this तो we have discussed. चलो Have we missed anything? I don't think so. No. I think we took majority of the images. Don't think I've missed anything. Okay. Maltese cross, yes, we have done. Negative staining, Cryptococcus, India ink, yes. Should wife with Candida, this one. What it shows? Reynolds phenomenon, right? We just saw chromoblastomycosis, we saw a better image, copper penny bodies, medlar bodies, right? Histoplasmosis, we saw penicillium is not asked. This one HHB6 we saw. So I think we have covered a majority of the topics. If something is left, I will take it in with your patho images, right? So these are brief image session about your microbiology, and the theory part I have discussed earlier, right? So okay, thank you guys for joining, and I will see you at next session, which I will discuss pathology, I hope or dharma. Okay, so by then, stay tuned and good night, right? Take care.